Hello everybody, my name is Alani Nusakabi and I will be doing my presentation on childhood obesity. So number one, the public health problem. Why does this problem exist in society? So since the 1960s, there has been an alarming increase in childhood obesity, and that is due, in fact, to either genetics or unhealthy behaviors such as overeating processed foods and unhealthy foods, as well as lack of physical activity. How does childhood obesity happen? According to the World Health Organization, or the WHO, unhealthy eating and little to no physical activity are the main causes of childhood obesity. Obesity is likely to occur because there's a disproportion between intake of energy and expenditure of energy. That means that the amount of food that they are eating is not equal to the amount of energy they're burning off from eating that food. So if a child's body mass index or BMI is above the 95th percentile in their age group and their sex group, then they are classified as obese. Other factors that may contribute to childhood obesity could be socioeconomic status, environment, and education. So again, public health problem continued. So where does childhood obesity occur? Childhood obesity often occurs in the United States, although it is a global epidemic. There's a alarmingly high prevalence of obese children in the U.S. Uh, Most obese children come from low and middle income families or communities. And what are the risks for them in the future? Children who are obese at a young age are more likely to be obese in their adult lives. So, obesity commonly follows them to their adult lives, and they are also at risk for cardiovascular disease, cancer, type 2 diabetes, as well as psychological problems like depression, isolation, low self esteem, and anxiety. What are the etiological factors? African American and Hispanic children are more likely to be obese than white children and Asian children. African American children, there's a 22% obesity rate. Hispanics are 25.8%, white children 14.1%, and Asian children 11%. Here on the left, I have a graph showing the percent obesity prevalence in children. So for 2 to 5-year-olds, the percent of obese children are 13.9, 18.4 for 6 to 11-year-olds, and 20.6 to 12 to 19-year-olds. So two strategies in combating childhood obesity are one, the World Health Organization suggests that parents should incorporate physical activity into their daily routines by taking family walks or playing outdoor games together, as well as adjusting their children's diets to include more fruits and vegetables. I think being able to do activities as a family would encourage children to stay active and healthy. And for strategy number two, further implementation of programs similar to the CDC's early child care and education obesity prevention program across the US. Here on the left, I have a picture of a few states, including California, Arizona, Kansas, Missouri, Indiana, Kentucky, Alabama, Florida, Virginia, and New Jersey. These are all the states, or some of the states, for the CDC's early child care and education obesity prevention program across the US. How to solve the public health problem continued. How did other countries or what has occurred in history that has helped combat childhood obesity? In Finland in 2009, I might mess this name up, Seinäjoki, a Finnish city, had 1 in 5 children who were obese due to lack of health and physical education. And in order to combat that, Finland created a healthcare act that was made to target obesity in places like Seinäjoki by providing equal free health counseling to all families, implementing health nurses to give children health examinations and teach them about healthy lifestyles, both physical and mental, and providing free healthy lunches in schools. So by doing that, they noticed that there was a decrease in children who were obese in communities like Snajoki. And in California, they created the California Endowment launched a 4-year Healthy Eating Active Communities initiative in March 2005. And this program was created to reduce the high rate of obesity and diabetes in low income and minority communities by increasing opportunities for healthy eating and physical activity. So they committed to changing environmental factors such as unsafe neighborhoods so that people could be able to go out and walk, and also by helping gain more access to fresh foods. They worked in schools and after school programs, worked with media advertising, neighborhoods, and healthcare. And one example is the Latino Health Access, which is based in Santa Ana, which is close by, that targets predominantly low income Latino areas and works with school districts and health departments to reduce environmental risks of obesity. This picture on the left shows 6 things that can help children combat obesity. So, what can be done to prevent the reoccurrence of childhood obesity? Um, First, an increase in physical activity. The U.S. Surgeon General recommends at least 60 minutes of physical activity each day for children, and the World Health Organization suggests that there should be an overall increase in fruit and vegetable consumption, such as creating a healthy feeding relationship early on in life for children, so that obesity in the future could be prevented. Also, on the community level, creation of health walks, as well as healthy food festivals, safe walking and bicycle trails, and providing literature about childhood nutrition to parents can help combat obesity as well. Personally, I believe that it's important to teach children healthy eating at a young age in order to prevent future life illnesses. Also, implementation of programs at school that introduce new and different fruits and vegetables each month, starting in kindergarten. Growing up in my elementary school, every month we had a fruit or vegetable of the month that we would read upon and also get to taste. And it really showed me new fruits and vegetables that I've never had before. And it introduced me to something like a persimmon. And I also believe that encouraging children to participate in outdoor activities both at school and at home can decrease the childhood obesity rate across the US, as well as give kids a healthy alternative to sitting in all day and watching TV or playing video games. One thing that I really liked was growing up was the Nickelodeon Worldwide Day of Play, which one time a year Nickelodeon encourages children to go out and spend the day playing and getting exercise. So for between 12 p.m. and 3 p.m. on this one day, Nickelodeon cancels all its programs and has basically a screensaver on their channel encouraging children to go out and play. And I think that their idea is great because they are able to market to children where they spend most of their time, which is watching TV. So I believe childhood obesity can be prevented in so many ways. It just matters on how the community acts towards it, as well as families and parents. Thank you.